We're back now with a look at a new global study that is sounding the alarm on obesity. It was published in the Lancet journal and predicts that by 2050, more than half of all adults will be overweight or obese, and a third of children and young people.
Researchers are calling the results a profound tragedy, but they say there is still time to turn things around. But that's if governments worldwide take urgent action. Joining us now for more, NBC News medical contributor Dr. Natalie Azar. Obviously, staggering numbers predicted here. What are the factors behind this?
So I think there's probably, 5 big domains that we talk about in terms of what the cause is. One is a lack of physical activity, and especially we worry about young kids, screen time, sedentary jobs. I think the next category could probably really stand on its own, and that is unhealthy eating behaviors. We've basically made what experts are calling a nutrition transition from whole and plant-based foods to more processed foods that are more animal-based. And think about all of these packaged foods that are so calorically dense with high sugar and high fat, just terrible, terrible for us. Poor quality sleep, stress, not just stress releasing the cortisol, which is a stress response that can affect hunger, but economic stress that also leads to food insecurity, and then health conditions, things like PCOS, metabolic diseases that can also disrupt your hormone balance, that can disrupt hunger and things like that. So a lot of different factors that all play into this.
This conversation, though, is happening right when we talk so much about weight loss drugs.
Yes.
And it almost feels like they just were like this miracle thing that bursts onto the
Right.
scene that we're hearing and learning so much about. It feels like almost every day. How does that play in here?
So the authors of this article do acknowledge that they are making these predictions and not including the impact that these weight loss medications could potentially have on those numbers. And I think they probably will make a dent on those numbers.
Yeah.
And we've spent a lot of time reporting on how amazing these weight loss medications are. And you can hear sort of in the background and say, well, are we just sort of treating the problem? Let's get to the underlying root of the problem, which we're also now having a conversation about. But do I think that these medicines will have a tremendous impact on sort of like slowing the progression of this obesity and overweight epidemic? I absolutely think that they will. And so we're very fortunate that this has happened in parallel, if you will.
When we look specifically at young people and kids, it feels like that takes systemic change.
Yes.
Governments.
Right.
Healthcare systems.
Right.
What are some of the steps that need to be taken?
And really, it does start with, individually, we can all make changes, obviously at the personal level, but this really will take a whole of government effort. It really is about identifying and prioritizing those individuals who are most at need. And we're talking about the socioeconomic factors that are limiting people's ability to actually have a healthy diet and a healthy lifestyle. There has to be a coherent public policy that sort of is generalized and universal for everyone in our country. And it's very, very important, I think, too, that there has to be some incentive to sort of have alternative practices. And what I'm talking about is supermarkets, food chains. There's got to be something in it for them in industry to start preparing more, healthier food options. We saw this over the last couple of years, McDonald's suddenly giving salads and things like that, but there has to be more of an effort, in all of those different arenas to make a difference. It just
feels like our food system is broken too, though, when you hear about like things that aren't allowed even to be in foods in other countries, versus here. That's where, as Joe mentioned, government help.
And again, to give credit where credit is due, if RFK Jr. can do something about that, all the power to him. We're all for it.
Bye-bye, red dye.
Right, exactly.
Thanks.
You bet.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.